All right. Hello. Good morning. Welcome, everyone. Before we jump in and get started, let me just go ahead and say that the information provided in this live is for educational purposes only and does not substitute for personal medical advice. We advise users to consult a local medical professional or healthcare provider if you are seeking medical advice, diagnoses, or treatment. Okay. Hello, everyone. Welcome. Thank you so much for joining us for this very special, exclusive segment of Derm Talk. This is our first time hosting this on Facebook, exclusively for our dermatology community. You guys are amazing in this community, and we wanted to go ahead and do something special just for our Facebook community. So for you guys, thank you so much for being here and for joining us. We're so happy to have all of you with us here today. For those of you who are new and have never joined us for these segments of Derm Talk, what we do is we sit down with a professional, a dermatologist from our Dermatology Advisory Board, and we talk about all things skin. We answer all of your skincare questions, we debunk myths, and we just learn and glean a ton of amazing, useful information from these amazing dermatologists that join us for these segments. So for everyone watching, I just wanted to please be sure to post any questions that you might come up with or think of during this live. Please be sure to post them in the comments down below, and we are going to get to as many of them as we possibly can. Okay, now that that's out of the way, we want to go ahead and just jump in and get started. My name is Linda, and I'm going to be hosting this special segment of Derm Talk. I'm so happy to be here with all of you guys today. And our guest today, she is no stranger to these segments. She was actually our very first dermatology guest, and it went so well, and we learned so much. We couldn't wait to have her back. So everyone, this is Dr. Marisa Garshick. Thank you so much for being here with us again. Welcome.
Thank you so much for having me. I'm so excited to be part of this community and love getting all the questions. So looking forward to a great, fun conversation today.
Yeah, absolutely. It's going to be great. Just real quick, a little bit about Dr. Marisa. She practices at MDCS in New York City, and she's also a clinical assistant professor of dermatology at Cornell. So she knows what she's talking about. So today's going to be a lot of fun. It's going to be very informational. And we've already had so many questions come in, even before we started this live, about at-home DIY treatments, different kind of skincare tools that you can use at home, what works, what doesn't, the pros and cons to have, you doing it at home versus getting it done professionally. So it's going to be a lot of fun today. And let's go ahead and just dive right in. Please don't forget to post your questions as we're going through this if you think of anything, and we will be sure to ask Dr. Marisa. Okay, so I want to just jump right in. This first one, I had actually never heard of before. So I'm really curious to hear what your take is on it. Someone asked, can you use baking soda as an exfoliant? Does it work? And is it good for your skin?
So yeah, so I would say we'll caveat all of DIY treatments as in many cases, certain people will find that they see improvement in their skin after doing certain DIY treatments, but it doesn't necessarily mean it's for everyone. So that's going to be sort of an overarching theme that a lot of the times when it comes to skincare, you do you, and if it works for you, that's okay. But it doesn't mean it's going to work for everyone. So baking soda specifically has been thought to act as a physical exfoliant, which basically means when we talk about exfoliation, it's this idea of getting rid of dead skin, and it can be done physically, where you actually buff away mechanically the dead skin cells, or chemically, which is more in the context of certain type of ingredients, whether it's glycolic acid or lactic acid or salicylic acid, which break apart the dead skin cells to allow them to go away. So a physical exfoliant, you always want to be extra careful on the skin, because it can actually cause these little micro tears in the skin barrier, which can lead to irritation. And so generally speaking, while it can be used as an exfoliant and it can get rid of those dead skin cells, it may not necessarily be the best idea. Sometimes I actually will tell people on their feet, if you want to sort of have a little DIY fun on your feet tend to have a thicker layer of dead skin. So oftentimes you can sort of use this without creating as much harm, but on your face, you do want to be mindful. And another part of this is that when we talk about baking soda, it's very alkaline, which basically means it's basic. And when we talk about the skin and the skin barrier and getting all into the nitty gritty, there's something known as pH. And if you affect the pH of your skin barrier or your skin too much, you actually can also lead to sensitivity and redness and dryness. So there are a lot of situations where you can run into, if you're putting baking soda on your face, that you may actually be doing more harm than good. So it can work, but it doesn't necessarily mean you should do it.
Okay, got it. So I kind of like that idea of using it on your feet. Instead, I had never even heard of using baking soda as an exfoliant anyway. So yeah, that might be kind of fun to try out and see.
Yes. And I always say with these physical exfoliants, a lot of it also has to do both with pressure. So the amount of pressure you're putting on
Yeah,
when you're
absolutely.
utilizing it, and then the granules. So, I mean, it doesn't necessarily mean that all kind of physical exfoliants are bad. Actually, one of the great microderm scrubs from dermatology is amazing, but it's because those granules are small. And so they're able to get rid of that dead skin without necessarily creating problems for the skin. So, but yes, definitely try it on your feet as we get ready, hopefully for some more summer weather in the coming months.
Absolutely. Yeah, our microdermabrasion scrub too. It is very, very fine granules and I love it. It works amazing. But even with that, you still don't want to scrub too hard. You can overdo it even with the gentlest of scrubs. So yeah, definitely something to keep in mind. Okay, now we have got a lot of questions actually about like at-home skincare tools that you can use. So I have a bunch of them here actually, so I can show what they look like as we go through this. So the first one was derma-planing. So at-home derma-planing, this is what the tool looks like. Something like this. It's got like a little blade kind of it there. Can you kind of explain what derma-planing is and if it's something you should do at home? Is it effective at home? Is it something you should go get done professionally? Kind of tell us a little bit about it.
Yeah, absolutely. So dermaplaning basically describes a very simple tool that has a little blade at the edge. And again, it's a very basic tool that we were able to just see there. And it's a form of physical exfoliation. So what that means is it's going to help to get rid of the dead skin cells. But oftentimes when people are using it, they're also using it to get rid of that peach fuzz. So we call it these little vellus hairs that often build up along the cheeks and you can really get it all over. And the idea of dermaplaning, so some people are just bothered by that peach fuzz and there's really very few other ways to eliminate it. So dermaplaning is great for somebody who's bothered by that. It does work as a great method of exfoliation. Now, the downsides of dermaplaning is that it is a tool, it is a blade, and you can cause injury to your skin if you don't do it correctly. And so you do want to be mindful of that. It's also something that not everyone should be doing at every time. So meaning if you have any active acne breakouts, if you are rosacea prone, if you're prone to getting like little bumps under the skin, you do want to be mindful that doing the dermaplaning can actually exacerbate those conditions. And even just if you put too much pressure the wrong way, you can create broken capillaries, which are sometimes more difficult to treat. So generally my feeling is there are a lot of great tools that you can get at home that accomplish the dermaplaning tasks. However, I often will recommend, if you really are committed to this as a form of exfoliation, I usually do recommend seeing a professional. So a licensed esthetician, go see your dermatologist to determine if you're even a good candidate for it. The one other thing though that I do find to be nice about dermaplaning when done appropriately and correctly is because you've eliminated that top layer of dead skin cells as well as those vellus hairs, sometimes your skin products can actually penetrate a little bit better. So there is some value in using it as a way to actually enhance the rest of your skincare routine. You just don't want to do it at the same time. So meaning if you're going to do the dermaplaning, you don't necessarily want to layer a retinol or something on top of it. But it is something that as you do it, it's going to create that fresh skin layer that's going to be more easily able to absorb everything else.
Speaking of that, I know that a lot of people kind of going on to our next tool that someone asked about is at-home microneedling. So kind of the same idea. A lot of people want to use this to kind of open up the skin so that they think their products are going to penetrate better. This is the tool, what it looks like. There's like a little wheel at the end. It's got these tiny little pricks on there that you kind of roll on the skin and you can feel them. It's just like tiny little pinpricks. Can you kind of explain what this is? Again, if this is something that you want to do yourself at home or you should go see a professional for, is it good? What does it do exactly?
Yeah, so the idea of microneedling, so I happen to love microneedling in the in-office setting because it's
Okay.
a great way to boost collagen production.
Mhm,
It's going to help with fine lines, it's going to help with textural changes, it's going to tighten the skin.
mhm.
But when we're in the in-office setting and I'm touting all of its benefits, it's because we're able to get to a deeper penetration than we are when we're using these at-home devices. So for
Okay.
me, at-home microneedling does always still come with a degree of pause because oftentimes people think they're going to get the same benefit that they
Mhm,
do with in-office microneedling, and generally speaking, that's not the case. However, what you brought up is a good point, and what is helpful with microneedling at home is that sometimes it can deliver sort of increased penetration of certain ingredients. And so some people are even using it for their scalp. So to help as a way of treating hair loss and kind of stimulating new
okay.
hair growth by creating a little injury. And so again, something that we do in the in-office setting with certainly more greater benefit and efficacy, but there
Mhm,
is some rationale to why you would use it in conjunction with maybe other products to boost penetration.
mhm.
Again, this is an area though where you can go wrong. And so, especially if you're somebody who has sensitive skin, or if you're unsure of exactly how to use it, or especially around the under eye area where the skin is much more delicate, you really want to feel comfortable and confident using it in order
Mhm.
to sort of make sure that your benefit outweighs any risk associated with it. So I do tend to stand on the side of, while there may be some benefits, you really do want to make sure that you're not experiencing any of those risks.
Got it. Okay. When you do use something like this, let's say someone did want to use it at home, are there,
Yeah.
because it is kind of very little, but still kind of breaking the skin a little bit, are there certain products or ingredients that you don't want to use right away when you're first using a microneedling tool and opening up the skin like that?
Yeah, so generally you would want to hold off from any sort of active ingredient. So any
Okay.
exfoliating ingredient, any kind of retinoid. In many cases, because these ingredients are a little bit more harsh on the skin,
Mhm.
if you sort of enhance the penetration of them, while one might think they might lead to greater efficacy, it can also lead to greater irritation and
Right.
sensitivity. So, so
Okay.
I usually say really steer clear of that. Oftentimes it's best you can do it with like a serum, like the Dermatology needleless serum. I guess
Mhm.
it doesn't make it needleless if you're using micro needles, but but theoretically, because there is a calming benefit with that, you
Right.
have niacinamide, you have
Mhm.
ingredients that generally should be okay. But typically, I
Right.
honestly would say finding like a very basic serum to use, like a hyaluronic acid or something like that, is probably going to be your best bet. But again, with most of these things, I honestly say, especially if you're using it in conjunction with an active ingredient, pick a
Mhm.
small area of your face to sort of just do a little test area, because what you don't want to happen is applying something to your whole face, all of a sudden creating irritation
Yeah.
and dermatitis or reactions everywhere. So really
Right.
just try to ease into it.
Got it. Absolutely. Yeah, that makes perfect sense. You don't want to use something like something strong, like a retinol or something, right as you open up your skin. So something calming,
Exactly.
like you said, like needleless serum would be great. But yeah, okay, perfect. Okay, this one, I've seen these before. I've never tried them, and I'm really curious to hear what you think about them. Um, the light therapy masks that you can do at home. It's like this full mask. Some have like a red light or a blue light. Can you kind of talk about, number one, what they do? Number two, if they work, these ones that you see, they see them everywhere, at home, if they work. And then what is the difference between like a red light versus a blue light?
Yeah, absolutely. So, a lot of what these masks are doing are certain types of sort of technology that we would use in an in office setting. So, we use LED lighting and
Mhm.
different types of light therapy in the in office setting to achieve benefits for certain kinds of skin conditions, whether they're more medically based, acne and things like that, or in more of the kind of cosmetic aesthetic side to help try to boost collagen. And so,
Mhm.
when you use these at home masks, they're doing something very similar, but it's at a slightly lower energy and intensity. And so it's allowed people to sort of get the benefit of what you're doing in an in office setting in terms of the technology from the comfort of your own home. Now, the downside is of course, the energy level is not the same because we don't want to pose any potential risk to somebody utilizing that same degree that you would get in an office setting at home. But there is some value to it. So the idea is that blue light can sometimes be helpful to reduce inflammation as well as the potential acne causing bacteria. So for somebody who is acne prone and maybe can't tolerate their prescriptions, or certainly for even somebody who's pregnant, sometimes the blue light can be a good option to help treat their acne during that time. So blue light does have some benefits for acne. In terms of the red light, we usually think of it more in terms of like anti-aging, because it can boost collagen. It tends to penetrate a bit deeper than the blue light. And so for that reason, it does have collagen boosting properties. Now, I usually say that the value of this really comes from just having an at-home kind of self-care moment. So you will see some benefits, and certainly you may see them quickly. Sort of when you take the mask off, you may even already feel like your skin looks a little bit better, but it is the type of thing that in order to really see significant improvement in these types of conditions, it's really meant to work in combination with a skincare routine, an in-office sort of relationship with a dermatologist to help kind of build that routine. But from skin maintenance, certainly it doesn't hurt. Some of these do get pretty pricey though. So I do always like to tell people that it's not necessarily the only thing your skincare routine needs. So don't feel bad if you can't get it, but if you did want to try it, there is some value to it.
Okay, great. Yeah, I've seen them price range anywhere from like $50, $60 up to over $1,000. I mean, the range is huge there. So yeah, definitely good information. This one, ultrasonic hand tools for exfoliation. So I do have one like that too. This one right here, it has like different settings, lifting, moisturizing, cleansing, but it's got like a little kind of scraper blade on there for exfoliation. It kind of vibrates and then you use it on your face like this. So is this something that works? What exactly does it do? Does it really exfoliate? Is it something that you should do at home? Is it something that you even do in an office like yours? Kind of tell us a little bit about this.
Yeah, so these are relatively kind of, for me, relatively new in the sense that it's not something that I hear a lot of my patients doing at home. A lot of what I come across are things that either we do in the office that have then sort of found their way into people's homes, or what my patients are doing and they bring them to me and say, should I be doing this? And this is one that I'm not as familiar with in terms of kind of lots of people using it. However, the idea behind it is that you're using this sort of ultrasonic vibration to help get rid of, kind of unclog the pores, get rid of the dead skin cells. So you're using kind of this combination of, again, physical exfoliation where you're sort of manually doing it, but you're using these high intensity sort of vibration component to loosen everything up. In general, my feeling with these is that there are other ways to help get rid of the dead skin cells and sort of soften and loosen everything up that probably are a little bit easier and just more straightforward, to be honest. I think salicylic acid does a great job of helping to get rid of blackheads. So I'm generally somebody who would say if you wanted to use it, fine, but I don't think it's necessarily the only way to get rid of like blackheads and unclog the pores. And certainly the benefit that you get from it will be considered temporary. It is surprisingly, even though it does have that little blade, it is relatively gentle. So these aren't necessarily that harsh on the skin, although you think with all this different kind of settings and everything it would be, but they are relatively gentle on the skin. So in that sense, with proper use,
it's a very smooth kind of thing. So when you rub it on your skin, it's not like pricking it or it's not doing anything like that. So
yeah. And so in that sense, it does, it again, probably has value, but for a lot of people, if you didn't want to put in the investment, I think there are other things out there that can also get the job done.
Right. Okay. This next question was another thing. I had never heard of this term before. It's called slugging. So I guess when you coat your skin in like petrolatum or Vaseline, is that gonna like super moisturize your skin? Is it gonna lock in moisture? Is there a purpose for like putting that and coating it on your skin?
Yeah. So yes, this has definitely been all the rage. I would say, honestly, even for the past like 2 or 3 years, it feels like it's had a comeback, and really exactly it is as you described. So we know that petrolatum has this ability to form an occlusive barrier on the surface of the skin. And what that barrier is doing is it's locking all the moisture in. And so ideally, when you're actually truly slugging, is you're applying another ingredient before it, so underneath it, that helps to draw moisture in. So whether it's like a hyaluronic acid serum or your moisturizer, and so that's sort of drawing moisture in, and then you're using the slugging technique to lock it all in, so that when you wake up the next day, your skin is going to feel extra hydrated, supercharged, and overall look nice, soft, look nice, soft and smooth. The benefit really I found for a lot of people, it's mostly for those who do have more dry, maybe even sensitive skin, who really need that strengthening of their skin barrier. But what comes as a surprise to most people is that really anybody can do it. So petrolatum is not considered to be in sort of these pure states comedogenic, so it's generally not thought to clog the pores. The one thing is that those who are acne or oily prone probably have some natural oils built up on their skin in excess. And so all of a sudden, if you're applying a thick layer of ointment on top of it, you're trapping all of that. So for those who are acne and oily prone, I probably would say to steer clear of it unless you really feel like you need it. But I do think a lot of people, because of wearing masks, who were experiencing some like skin breakdown, and especially early on in the pandemic, I think what we found from slugging is you're really able to sort of strengthen that skin barrier and protect from external irritation. So there is a role to it. The term, I think, makes everyone kind of giggle a little. So it's like, what are you doing actually to your skin? But definitely something that I think has become popular, and certainly with reason behind it.
Okay, yeah. I mean, I had heard about putting, like Vaseline or petrolatum and stuff on your face, but I never heard of the term slugging before. So that was new to me. Okay, moving on to our next tool. We got lots of tools, and so it's kind of fun to kind of show and hear what you think about them. This one's called Gua Sha. So if you kind of use a tool similar to something like this, it's got like a little ledge on there. You kind of use it here on your skin. You can move the other side, and kind of, it's like a facial massage tool or something, right? Can you kind of explain what it is and what it does?
Yeah, so it's been around in sort of Eastern medicine, so in Chinese medicine texts, as a way to help basically encourage healing and promote essentially lymphatic drainage. Because when you are moving and gliding it across the skin, you're helping to sort of mobilize different types of fluid. The literal translation is scraping, which is what it seems like you're actually doing. But when these stones are designed, they're designed to have different sort of textures on each side. So some areas are maybe a little bit more curved, some are a little bit thinner, some are a little bit thicker. And that allows you to kind of get into every nook and cranny on the face. So it really allows you to have this nice motion all around. The idea behind it is that by mobilizing fluid, you're going to be able to help decrease puffiness. You're going to boost circulation. So a lot of the times people will use it and then just feel like they have a nice glow to their skin. It'll boost their complexion. And overall, I mean, I do think that it's definitely a moment of self-care. So I think for people who like to do it, there is some value in just sort of taking that time for yourself and doing it. Again, it's not something that's going to replace your injectables or your skincare routine, but sometimes it can complement it nicely. And it's if you're on the go, if you're traveling, some people will say that they notice the benefits certainly immediately after for a couple of hours. Some people will say that they feel like they notice it for a couple of days after. It's not necessarily going to give you that long-term benefit of, let's say, wrinkle reduction or collagen boosting per se. But as a maintenance, some people do find that they see nice longer term benefits with it.
Yeah, it's definitely, it is a perfect self-care, like you said, kind of thing to do. It does feel really nice after you do your skincare, and it just glides really easily on your skin, and it feels good. It feels nice. So it is definitely a little self-care with some added benefits, like you said, of drainage or, lifting, things like that. So,
and some of the
yeah.
stones, so there are different stones that you can find. So when you
Mm-hmm.
start looking for a gua sha tool, and so in that sense, the different
Yep.
stones sometimes have different properties, and some are actually more cooling on the skin, which gives you an
Mm-hmm.
added depuffing benefit.
Yeah.
So I would say, I mean, I actually just had a patient today ask me about it. So this definitely comes up. I think it's definitely something that people are interested in and using and finding a way to incorporate it. But again, same type of thing, just avoid putting too much pressure on it, because even though it is gentle when it glides on, if you put too much
Mm-hmm.
pressure, you can do some harm.
Right. Okay, thank you. Good to know. Next question, IPL. How do you know if the laser at the spa is as effective as at the dermatologist's office? So kind of, can you tell us what IPL is first, and then
Yeah.
kind of answer that second part?
Absolutely. So IPL stands for Intense Pulsed Light. And so it's not a traditional laser in the sense that it's not targeting just one element, one wavelength. It has a more broad target. So it can be helpful for people who are experiencing redness or brown spots. So it does a little of everything. And so we often think of it as like this jack of all trades. And I think this is a great question. And really the answer is that you don't know if it's as effective. And so at the end of the day, because you don't know if the IPL that you're getting at a spa is the same as what you would get at the dermatologist, you really want to make sure you're going somewhere where you feel comfortable, you trust the provider, the person who's delivering the service, both for two reasons. One, you want to make sure if you're investing in a treatment that you're getting the result that you should be getting. But all these treatments do come with risks as well. And so you really want to make sure that you're in the hands of somebody who, obviously things happen, but you want to make sure you're in the hands of somebody who can handle any potential complication or adverse event if it were to happen. And so obviously minimizing the risk of anything. So I always say, because you don't, it's always best to see a board certified physician, a dermatologist, who can sort of guide you in the right direction for those types of treatments.
Yeah, absolutely. Okay, good to know. You don't know, like you said, so definitely go to someone that you trust. Okay, we're going to kind of go down to a skincare myth that someone had asked about. And I feel like this has been around forever. I'm in my 40s and I heard this when I was a kid. So if you have a breakout, putting toothpaste on it, does it really dry it out? Does it really help your breakouts?
Yeah, so this, exactly as you said, this has been around for a long time. And
Forever.
part of that actually comes from this idea that toothpaste historically was formulated with something called triclosan, which had antibacterial properties. So there was actually a very real antibacterial effect for some of the toothpaste to actually help maybe potentially reduce bacteria. Many are not necessarily formulated with that anymore, but have things like baking soda, hydrogen peroxide, which can help to dry the breakout out. So there is a theoretical benefit to putting toothpaste on your skin, but again, I always say, when we have great evidence-based ingredients that we know will actually help your breakout, unless you are really like stranded and the only thing you happen to have is your toothpaste, I usually would say that to avoid it, just because it can, again, be a little bit more irritating on the skin. And even though you might just be putting it on a small spot, what happens is when you put a dot on a spot, you end up potentially putting too much in that one localized area. So you end up developing a significant amount of irritation that ultimately can be worse than the breakout itself, because you've now created this redness and flaking, and all of a sudden you've drawn a lot more attention to the area than you previously had hoped.
Got it. Okay. I didn't know that it would actually work. So
I mean, there was a reason.
Yeah, but like you said, when there are proven products that are actually made for that specific thing, it's probably best to go like that. Like our 24-hour acne serum, I actually used it this week. I had breakouts along my chin. I've been getting them a lot lately, I think, because of the masks. And I put that on and it really does clear it up so quick. So definitely probably use something like that instead.
Exactly. That is a better way to go for sure.
Definitely. Okay, we did have a question come through on in the community, the Facebook community, and it's a good one. It says, "Is in-office thermage effective for firming?" Can you kind of tell us what that is first?
Yeah, so for sure. So in general, there's lots of different devices that are out there that use different type of energy to help firm the skin and boost collagen production. So there's ultrasound based devices, there are heat based devices, and they all do have benefit, and they're all going to show some degree of benefit in the right individual and the right candidate. And so for these types of things, I do say that we do have studies that show benefits, but usually it's determined based on your individual provider and you having that consultation to determine how much benefit you would see. But it is something that can be used certainly for the lower face, and even around the eyes. And what's nice about a lot of these ultrasound and radio frequency types of devices is that you are going to get not just the initial benefit, but you're building collagen over time, which is going to provide a more long-term benefit as well. So generally speaking, there are the benefits, but in order to understand how it would benefit you as an individual, it's always good to have a consultation to see if you're a good candidate.
Okay, I feel like that kind of leads a little bit into this next tool that someone asked about. Microcurrent facial massage tools for like lifting. I have one here. It kind of just has this little thing. You can turn it on. It's got like it, I don't know if you can hear it. There's just like this little microcurrent and you kind of use it kind of like the massager, and you use it like this, and it's supposed to help lift. Do these work? Is it something that you would want to invest in? Kind of tell us a little bit about that.
Yeah, so I would say it sort of falls into a similar category, where there probably are some immediate benefits that you'll notice where you will see that immediate lift just by virtue of kind of manually putting that pressure on the skin. That vibration helps to depuff, boost circulation, gives the skin a nice glow. And the idea behind microcurrent is that you are going to help to boost collagen production. Again, when it's an at-home device, you're somewhat limited in the extent of collagen that you will sort of generate from it. But there is some value. This is another area where sometimes the products or the devices rather sometimes can be a little bit pricier. And so it's really a matter of deciding kind of where you want to put that money. So there is some benefit, but it's certainly not going to be the only thing that I usually say is going to deliver the results that you're looking for.
Right. Something that you want to incorporate into, like you said, a skincare routine or other things that you're doing to your skin. Okay. There's a couple kind of going back to the myths, skincare myths, and different things or, questions about oily skin. We kind of hear this one all the time. If you have oily skin, a lot of people say you don't need moisturizers. You should stay away from moisturizers or, oils or things like that. Can you kind of tell us the truth about that? What does oily skin really need?
Yeah, so oily skin in general does need moisturizer. So we want to make sure that whatever skin type we have, we're keeping that skin balanced. And what that means is that if your skin is oily, it doesn't mean that you don't need moisturizer. It just means you need the right type of moisturizer. So you want to use one that won't clog the pores, that's lightweight, that essentially feels good when you're putting it on, won't leave the skin feeling greasy, but does still keep your skin in balance. And the reason is that if you dry your skin out too much by not actually applying moisturizer to the skin, it's going to trick your brain essentially into thinking that your skin is drier, and it's going to actually produce more oil. So all of a sudden you have oily skin that's then become dry, that's then triggering more oil and then leads to more breakouts. And then all of a sudden you're not sure what to do. And so usually I say, definitely commit to a moisturizer. You may not feel the need to do it twice a day. Maybe you feel like once a day is sufficient, but just making sure you're finding the right moisturizer.
Right. Yeah. By not moisturizing, you're almost doing the opposite effect of what you want. Like you said, your body can produce more. So that's not what you want. Okay, good. We had another question come through, and this is a good one. Retinol. It says, can you discuss retinol concerning why one should or should not use it? What would be the schedule to begin with, and what side effects are expected versus when to discontinue use because of the side effects? So what are the side effects that you're going to experience sometimes when you first use it that you want to continue using it and it's okay, but then versus like a bad reaction and when you should stop it?
Yeah, absolutely. So I think with retinol, most people consider this idea of the purge. So
Mhm,
retinols in general are great. Obviously, we know they have lots of great benefits when it
mhm.
comes to helping to stimulate new collagen. They can be helpful to even out skin texture, tone. Obviously, they're great for breakouts. So there's lots of great benefits that retinols do offer. In terms of introducing them, I usually recommend doing it sort of low and slow, so a low concentration and slowly building
Absolutely.
up the frequency.
Mhm.
And in doing so, you can sometimes minimize potential side effects. However, when this idea of what's happening in those first couple of weeks of using a retinoid or a retinol, you may experience what's known as the purge, which is essentially this idea that your breakouts get worse before they
Mhm.
get better. And a lot of the times it's because your retinol is stimulating new skin cells to turn over. Anything that was kind of right at the surface sometimes gets pushed to the surface. So you'll see that usually within those first couple of weeks if you're going to see it, but it does tend to subside after a couple of weeks of use. So you really do want to kind of push through it if you can, as long as you do feel kind of pretty comfortable knowing that that is what it is.
Right.
In terms of irritation or sort of more of a reaction that's considered a side effect, I would say that tends to be more redness and flaking. And that's an area where I usually say, skip a few days, start again. You never want
Yeah.
to keep putting your retinol on an area of skin that's compromised. So if it's red and flaky, putting
Right.
more retinoid on that's not going to be helpful. You want to allow your skin some time to recover, maybe slug a little bit to to get that
Mhm.
skin barrier back in shape, and then you can sort of continue on with the retinol after that.
Definitely. That was my experience. When I first started retinol, I wasn't expecting the dryness that I experienced. And so I was using it a couple times and my skin just started drying out and flaking everywhere. And it scared me. And so I stopped. I didn't use it at all for the longest time. And then that's exactly what I needed to do. I just slow. I put it on. I think I waited like 3 days before I used it again. And I slowly built up. And now I'm using it every night. But it was
Right,
a very long process to build up to that.
right.
So yeah, but again, it's normal. You just got to be slow with it, give your skin time to adjust, and it definitely works though.
Exactly. Slow and steady is the way to
Yes,
go with
slow and steady.
retinol.
Definitely. Okay, this one I'm I'm really curious because I actually have friends who only do this and they swear by it. And this is literally all they do, this and moisturizer. Just using a regular bar of soap to wash your face. Is that something that you should do? Something that you should use, or what are the pros and cons of that?
Yeah, so a traditional bar of soap, as it kind of historically was thought to be, really was defined by the idea of soap being what's being used to cleanse the skin, and that's actually something known as a surfactant. And surfactants are designed to help cleanse the skin, get rid of the oil, the dirt, the buildup. And soap historically is thought to be a very basic, again, sort of something that can affect the skin's pH. Element. And so, as something that's a little bit more alkaline, when you use soap on your skin, you can actually disrupt the skin barrier. You can strip the skin of its natural oils, and therefore you leave the skin feeling tight and irritated. Many
Mhm.
people associate that feeling with feeling squeaky clean. So they're like, oh, great, my soap has done what it's supposed to do. But as we've learned and we've sort of recognized the importance of caring for our skin barrier and keeping that sort of
Mhm.
natural pH where it should be, which is slightly more acidic,
Mhm.
we've recognized that we don't need soap to sort of get rid of everything. So now there are more gentle surfactants that are designed to help gently but effectively cleanse the skin while still
Mhm.
maintaining that natural moisture. So I would say bars of soap traditionally are generally not recommended. However, there are some bars that have been formulated using different types of surfactants or using moisturizing ingredients. So it's not that all bars are created equal, but
Right.
definitely that like historic like bar of soap is really what you would probably want to avoid, especially in the winter months.
Got it. Okay. We had another question come through. I'm going to go ahead and ask this one, and then I think we're going to start wrapping it up. Okay. Is it fascia or fascia?
Fascia.
Fascia. Okay. Fascia manipulation. Can you tell us a little bit about what that is and if it works?
Yeah, so the fascia is essentially a deeper layer that's actually below the skin. It's actually like a little band or sheet of connective tissue that goes below the skin.
Mhm.
And it essentially helps to separate the muscle and it helps to kind of stabilize everything. And
Mhm.
so, what can sometimes happen with this as we get older, essentially, it can become actually much more tight and restricted. And so, in a normal healthy state, it's actually more relaxed, so it allows for a little bit more movement, which is helpful in terms of your collagen and elastin and just allowing things to do what they need to do. So the
Mhm.
idea of fascial manipulation, which again, it sort of goes along with this whole idea of whenever you do some type of massage, you may be helping to reduce some of that puffiness and help kind of firm things up a little bit.
Mhm.
It's really sort of relying on that. I think it is hard to know. It's thought that I mean, because it's such a deep layer that you're trying
Right.
to achieve, it's hard to know sort of that impact overall. But some people do notice benefit after utilizing it. But a lot of it is again this sort of active massage that can be helpful.
Okay. We actually had two more questions pop up that I want to ask you real quick. So we'll go ahead and touch on
Yeah.
these and then we'll wrap it up. But this one, kind of going back to the retinol question again, what products should you avoid when you're starting retinol? Is there anything that like
So
could kind of
yeah,
counteract it or something that you should avoid?
that's I think such an important question because I think so many people, and especially within this community, are so educated and so savvy on lots of different
Right.
skincare ingredients, and everybody wants to sort of use it all. But
Yep.
I always tell people if you're starting a retinol, really start kind of by limiting everything else and then slowly
Yep.
incorporating
Absolutely.
everything back in. And so you definitely
Mhm.
want to avoid using like an exfoliant on those same days. You don't want to skip out on your moisturizer. So I often will tell
Mhm.
people you can do your cleanser, your retinol, and then a moisturizer on top of it. It's still fine to do like a vitamin C serum in the morning or a peptide cream. So things that are
Mhm.
still going to be gentle on the skin, but anything that's another harsh or active ingredient, whether it's benzoyl peroxide, you want to
Yep.
avoid necessarily doing simultaneously. So really, I always say the most successful way to start a retinoid is to keep your routine very simple, get to a good point
Awesome.
with your retinoid, and then start incorporating other ingredients. You can
Mhm.
always use other ingredients on the alternating nights. So that's another way that people who are dealing with multiple skincare concerns can still address them. But I always say your priority when starting a retinol should be the retinol. So take advantage of that.
Absolutely. Okay. And then this last one, what products do you recommend for dark spots? Or would I need to look more into a laser treatment for unwanted spots on my face?
Yeah, so this is a great question, and I think there
Yeah.
honestly, it's so hard to say because I do think that there's so many different treatment options, and the reason
Right.
is because there's lots of different reasons that we get dark spots. So
Mhm.
sunscreen is going to be your first, second, and third treatment for dark spots, and I say that
Yes.
because it really
100%.
there's no underestimating the power of sunscreen because even if you do laser, or even if you're doing other skincare, you are going to sort of reverse any progress if you're not really diligent about sunscreen, whether it's
Yep.
winter, cloudy, snowy, rainy, you name it. You really want to be
Yep.
extra diligent. So that's one. In terms of other ingredients, though, to seek out, so certainly retinols can be helpful for dark spots, antioxidants. So vitamin C is great. So in terms of the vitamin C serum from Dermatology, that's a great option to incorporate into
Yep.
sort of a discoloration hyperpigmentation routine.
Mhm.
Niacinamide's another great ingredient that's known to help with hyperpigmentation. So another great option there. And then you could always speak to a board certified dermatologist because there are some prescriptions, whether it's in the form of an ingredient known as azelaic acid as a prescription that's available,
Mhm.
and some other things there. But lasers, chemical peels, exfoliating is another great option for hyperpigmentation. So even
Mhm.
the like tingle pad, so has lactic
Yeah.
acid, glycolic acid in it, which are also going to be great options to help with hyperpigmentation. But again, this is
Okay.
another area where you want to make sure you're minimizing irritation. So start by incorporating one thing at a time, see how your skin does, and then go from there.
Awesome. Thank you so much. This was such a fun segment. I know that we went a little bit longer than normal, but I feel like we learned so much. Thank you for answering all these questions. And for everyone, if you posted a question and we weren't able to get to it, please know that we will address all of the questions that were posted in there. We will get back to you with answers. Even if you think of something later, please feel free to reach out in the community or to us. And we will still go ahead and answer those too. So if you think of something later, like, shoot, I should have asked Dr. Marisa this, reach out to us and we will get back to you with the answers. I just want to thank all of you for joining. I loved having this exclusive Facebook community live today. It was so much fun. And Dr. Marisa, thank you for coming back and doing another one of these with us. It was so much fun and we learned a lot. And yeah, I can't wait for our next one. We do these monthly. So please be sure to check out our next one too. Dr. Marisa, thank you.
Thank you for having me, and thanks for all the great questions.
Absolutely. Bye, everyone. Thank you.